Today I'm going to talk about the neighborhood factors that contribute to obesity risk and obesity-related behaviors. I'm going to talk specifically about diet, although we know that there's a broader focus on both diet and physical activity. I'm going to center in particularly on diet. So by the end of this lecture, you'll understand more about the contributors to obesity risk, particularly those factors that are at the neighborhood level. And then I also would like to speak specifically about how neighborhood factors influence disparities in obesity, particularly in those high-risk groups, communities of color and low-income communities. Traditionally, researchers focus specifically on individual factors, but if we look at this diagram, we realize that there's multiple influences on obesity risk. We think about this kind of socio-ecological paradigm. So there are individual factors, but we know there are behavioral settings that influence obesity. We think about other sectors of influence, and one of those sectors is really the neighborhood. Neighborhoods really can influence your risk of obesity because it's where you live, where you work, where you play. We've heard a lot about what resources are available in neighborhoods and how those can influence disease risk. We know that there's other types of cultural and physical factors within the neighborhood, what people know, social norms within the neighborhood. All of those factors contribute to what we think of as energy balance. So we know that there's diet on one side and there's physical activity on the other side. So what you take in is really balanced against what you put out. And we know that many opportunities are shaped by the neighborhood context. So when we think about diet, just really think about what kind of factors contribute or influence what people eat in a neighborhood. There's different restaurants, there's stores or the lack of stores. There may be community gardens. And there's also other things like emergency food outlets, like pantries. There's also factors in a neighborhood that might shape opportunities for physical activity. If there are parks or walk-in trails, and then also there's social factors that may contribute to that. So are the parks safe for children to play? Are walk-in trails safe for people to walk? Can people walk around the neighborhood? So all of those factors at the neighborhood level can contribute to behavior, which in turn contribute to obesity risk. And we know that the prevalence of obesity can really raise an individual or population risk for other types of health conditions like cardiovascular disease, diabetes, and even cancer. What's particularly striking about neighborhood research right now is that we know that there are inequities in neighborhoods. In hundreds of neighborhoods across the country, both in urban as well as non-urban areas, we know that people lack access to the resources that they need to be healthy. Many of those resources are related to food, and I would like to center in since my research is focused on food access in communities, I want to talk more specifically about some of those factors. So what do we think of when we say food environment? I mentioned things like grocery stores or restaurants, but we know right now food is everywhere. We know that there may be sit-down restaurants versus fast food restaurants. We know that there's also things like mobile carts that people don't think about. In some neighborhoods where you have street vendors that play a role in the food environment. So many times we think traditionally about a supermarket being there or not, but really the food environment in a neighborhood may be more dynamic. It may be more comprehensive and more diverse. There's also other things like the school food environment that play a role in neighborhoods. Many people use the term when neighborhoods lack availability, they call it a food desert. And the food desert term was originally proposed in Scotland in the early 1990s, where it was classified that urban neighborhoods without ready access to fresh and healthy and affordable foods would eventually have an impact on health and well-being in communities. Many people don't like that term food desert. Some people use things like the grocery gap or low food access areas. Talk about the attributes of communities versus kind of a classification of saying a community is a desert. We know that differences in neighborhood food environments can also contribute to disparities in obesity. Most of these disparities that we think of are by either race, so differences in health outcomes between different racial or ethnic groups, and then differences in health outcomes based on socioeconomic status or income. Research has shown that low-income neighborhoods consistently are associated with low availability of fresh fruits and vegetables, poor quality fruits and vegetables, and more convenience and corner stores as compared to supermarkets. So fewer supermarkets, and then also more fast food restaurants. Other studies have also shown that as compared to predominantly white communities, that predominantly African American as well as Native American communities also have a lower availability of fresh fruits and vegetables, a greater prevalence of poor quality fruits and vegetables, and then higher availability of things like corner and convenience stores and energy dense food options. So for example, a study that was done in Cook County, which is here in Illinois, when you look at the characteristics of quote unquote food deserts as compared to non-food deserts, those communities were more likely to have a higher prevalence of African Americans residing in those communities, more individuals that lived in poverty residing in those communities. Many of the residents in food desert communities were more likely to have less than a high school education, less likely to have bachelor's or higher, and more likely to be unemployed. So when we look at those communities, many of those communities not only lack food options, but they may lack other opportunities for leading a healthy lifestyle. What do we know about the links between these low resource communities and obesity? If you look at the latest data from the National Health and Nutrition Examination Survey, you see disparities by both race and income. And I want to just highlight one of those disparities because when you look at female weight status by race and ethnicity in the United States from 2009 to 2010, non-Hispanic Black women actually have the highest prevalence of overweight and obesity as compared to all racial, ethnic, and gender groups. If you look at the diagram where you look at overweight, which is classified as a BMI equal to or greater than 25, obesity, which is classified as a BMI equal to or greater than 30, grade 2 obesity, which is a BMI equal to or greater than 35, and then grade 3 obesity, which is a BMI equal to or greater than 40. Almost 81% of African American women or non-Hispanic Black women have a BMI over 25 or are classified as overweight. Nearly 50% or a little over 50% actually fall into the obese category. This exceeds the prevalence for both non-Hispanic white women as well as Mexican American women. What's particularly concerning is the prevalence of class or grade 3 obesity or BMI over 40. Almost 20% of non-Hispanic Black women actually have a BMI over 40 or fall into that grade 3 obesity category. Many people believe that it's not just personal choice, but that it's neighborhood resources that contribute to those disparities. You see similar disparities by income when you compare individuals of higher, within a higher socioeconomic category as compared to those that are in a lower socioeconomic categories. Or many people think about those that fall in or have a higher socioeconomic position as compared to a lower socioeconomic position. So what do we know about these neighborhood food resources and diet? Availability of healthy options or studies show that availability of healthy options are associated with an increased intake of fruits and vegetables, low-fat milk, as well as weight status. There's also a relationship between cost of food options and perceptions of food environments, although some of this work has yielded mixed results. Some studies have actually shown a relationship between the cost of food options in a neighborhood and dietary intake at the individual level. Also, studies have found that neighborhoods that have more supermarkets or certain types of outlets like full-service restaurants are associated with higher dietary quality or a better dietary intake. So neighborhoods that have a higher concentration or higher density of corner stores, those neighborhoods have also been shown to have a lower prevalence of fruit and vegetable intake and a higher weight status. The research on neighborhood and food environments is also, it goes beyond just looking at the environment. It also, some of that work also has looked at actual usage patterns. So people that use certain types of outlets may have poor dietary intake or better quality diets or better dietary intake based on the outlets that are both available and used. So some studies show that people that are more likely to frequent corner stores or that depend on corner stores for purchasing food options, that they're more likely to have a higher intake of chips, candy, and sugar-sweetened beverages as compared to those that shop at supermarkets. Studies have also found that shopping at a supermarket may be associated with higher fruit and vegetable intake. But there's some limitations to the work or research that we have on neighborhood food environments. We know that neighborhood food environments do play a vital role in both obesity prevention as well as contributing to obesity risk. We know that neighborhood environments actually play a vital role in shaping obesity risk as well as in obesity prevention. But we know that some of this work may be oversimplified, that people or neighborhoods may contribute in multiple ways, not just through the pathway of behavior, but also that low-income neighborhoods may have other characteristics like unemployment or poverty, which also has been shown to contribute directly to obesity risk, not just through diet or physical activity. Low-income consumers may also seek options outside of their neighborhoods to maximize their food dollar. But issues related to economic resources may also play a role. It may be a combination of what people have access to, but also what they can purchase with their food dollar. So although we know neighborhood is one factor, and neighborhoods may also be linked to the solution, that if we change the neighborhood food environment by building more supermarkets, as well as making sure that people have healthier options, we can't do that in lieu of economic supports. So we still need things like food assistance to help support low-income consumers, but we also have to expand availability. So those two things may actually work together. And this is really supported by the literature. Some studies have shown that building a supermarket alone can have limited effects unless you have other economic supports. Corner store and convenience store interventions may also be a way that you can change communities. So it's not just bringing in new supermarkets. We know that you can also intervene at corner stores to expand food options, and that may help contribute to communities and change the neighborhood food environment. And then we may have to have other options outside of supermarkets to expand availability. So things like farmers markets or community gardens, and that empower residents to take control of their food environments and really be in the leadership of changing what's available in their neighborhoods.